I'm Dr. Dustin, and I'm trying to just work for free as a dermatologist. Today is our debut with a mobile clinic. I purchased this 39-foot motorhome, and we're doing a free community skin cancer screening event. And this is our debut. We're also going to go out and provide full dermatology care to underserved people. Today, I'm going to be teaching you about how to spot skin cancer when you do self-skin exams. Follow along with me, check out the event, and hopefully learn how to identify skin cancer if you've got a spot you're worried about. So this motorhome is equipped with 2 exam rooms, and I'll be doing skin cancer screenings in the front room and in the back room. I use a tool called a dermatoscope to help highlight specific features of spots on the skin so that we can earlier identify concerning spots. Let's go check out the back of the motorhome. Here we've got a refrigerator so we can store medicine if needed. Lots of storage for all of the items when we're doing the full suite of dermatology care. Pretty soon we're actually going to go to an uninsured clinic and provide free care to people that just don't have insurance. And then as we come to the back, we've got a room here big enough to do surgery in, and they can even watch Netflix if they need to. So that is the mobile clinic, and let's start doing some exams. So we started the exams, and already we found what we think are 3 different basal cell carcinomas and potentially a melanoma. So let's talk through what those might look like if you're checking your own skin. Basal cell carcinoma. This often is a pink papule or a pink bump. It often has a shiny appearance. If you shine a light on it, kind of reflects back at you. And we usually see what they call arborizing telangiectasias. And that just means blood vessels that look like a tree growing out from each other. And you're gonna see pictures of that here on the screen. A basal cell carcinoma might bleed easily if it's washing your face or drying your face off. And these are the types of things that almost never metastasize. They don't spread inside the body, but they could be locally disfiguring. One of the ones that we saw was right on the edge of the nose, and that surgery is not gonna be fun for a person to go through to have that removed. So if you do have a spot like this that you're worried about, I absolutely recommend don't put it off. Go see a dermatologist and have them check it out ASAP. All right, I'm here with Quinn Schroeder. He is a medical student going into dermatology, and we're gonna talk about squamous cell carcinoma. Squamous cell carcinoma is the second most common type of skin cancer, and it often appears as a scaly red spot. It may bleed, and sometimes they'll grow up like a dome on the skin really quickly. And they're most likely to appear in sun-exposed areas on the body. Quinn, tell us a little bit about the risk factors, like what might predispose somebody to getting a squamous cell carcinoma?
Yeah, so with squamous cell, one of the biggest thing is that chronic sun exposure, right? So what that means is like the little bit over time with regards to your sun exposure, and that can lead to that squamous cell. Some kind of notable things that are important to think about is like those common areas in which you can get it. So you think like your lip, your ears, which some people don't think about. So make sure when you are out in the sun, you're applying sunscreen to those areas because you can get the squamous cells there.
Yeah. So when you're wearing a ball cap, your ears are always still exposed, and I've cut so much squamous cell off of people's ears. I've taken away a ton of a percentage of people's ears. So if you have a scaly spot that doesn't heal, sometimes they're painful to the touch, even just light touch. Those are absolutely things that you should be getting checked out. So squamous cell carcinoma, second most common type of skin cancer, and it does have a risk of metastasis, of spreading inside the body. Basal cell almost never does, but squamous cell carcinoma absolutely can. And so you have to get those checked out. You have to get them treated and removed if you're concerned about something like that. And the best way is to see a board-certified dermatologist. Next up, we're talking melanoma. This is the skin cancer that people most fear, and for good reason. Melanoma kills about 10,000 people a year in the United States, and this year alone, nearly 100,000 new cases of melanoma will be diagnosed. Now, thankfully, we've made great strides in identifying melanoma at earlier stages because people are seeing a dermatologist more often. But if you have been in a tanning bed, you're definitely at an increased risk. If you've gone tanning outdoors, you're at an increased risk. And bad sunburns, especially in your youth, also increase your risk of melanoma. So when you are doing a self-skin exam at home, which I recommend that you do once a month, get in your birthday suit, grab a hand mirror, and look at everything. And you're gonna be checking for something called the ABCDEs. This is the things you'll look for And Haley, also a medical student at ICOM, Idaho College of Osteopathic Medicine, and future dermatologist, is going to teach us about the ABCDEs of melanoma when you're doing a self-skin exam.
So for the ABCDEs, what you're gonna wanna do is you're gonna find the spot, you're gonna look at it. A stands for asymmetry. So if the spot is at all irregular shape, not round, that's one of the signs that we're supposed to look for. B is for border. So you're gonna look at it again. If the border is not clear, if the margins are not perfectly circular, then that's another sign. C is for color. So if you look at it and it's varying in color, especially if you see any red, blue, or white, that's another sign we're looking for. D is for diameter. So if you have spots all over you, that's okay. We just look and see if it is bigger than 6 millimeters. That's something we also want to look for. And then E is for evolving. So if you have a spot that you've seen your entire life that stays perfectly the same, that's a good sign. But if it starts changing over time, that's also a sign that we want to look for melanoma.
When you're doing self-skin exams, the evolution or change is one of the most important things to look for. If a spot has looked one way your entire life and now it looks something different, definitely get it checked out. We also look for something called the ugly duckling. If you have a bunch of spots that are black moles and then you have one that's maybe tan, that is the ugly duckling. It's not always going to be an ugly looking mole, but it stands out among the pattern of type of moles that you make. And so if you see something that is different than the other moles and spots on your body, you should have that checked out. A full skin exam with a board certified dermatologist where we may take photographs and measurements and follow that over time is the best way to screen and prevent skin cancer. And if you do develop it, to catch it at an early stage. So we have covered basal cell carcinoma, squamous cell carcinoma, and melanoma, the 3 most common types of skin cancer. Now you know what to look for when you're doing your skin exams and what you should take to a board certified dermatologist to have an exam in a professional setting. All right guys, I want you to meet the detail kid. He is the youngest certified auto detailer and you've traveled to some pretty cool places. Yeah. What's your favorite place you've traveled to go detail?
That's a hard one.
Yeah.
I would have to say the Peterson Automotive Museum in LA.
Ooh, that sounds awesome. I'm gonna
yeah.
have to check that out. So we're coming in for a little skin check today. You got a couple things you're worried about. We don't need to go into like detail on them, but what prompted you to come get a skin screening today?
Well, so I would pick at this right here on my arm and it just keeps coming back. So I wanted to get that checked on my face.
Well, we'll check that. One of the most important things you can do to prevent skin cancer is to start using sunscreen and protect your skin at an early age, so you're being proactive. I love that. With your work, you're outside all the time.
Yeah.
So you got to get the sunscreen on. Love your hat, but we need sunscreen on the ears and all of that stuff. You know, I got this big vehicle here. Do you think you could detail it sometime?
It would depend if Dad could help me or not, but
You can have all the help you need. Have you ever detailed something this big before?
no.
All right, well, we'll see if he's up for the challenge, but let's take you inside. Let's take a look at these spots and hopefully provide some reassurance with what's going on. All right, Steve, thanks for coming in. We're gonna be taking a look at a couple of spots for you. You guys detailers in your family, or are you like the first one getting into it? Or Dad leads the way?
Yeah, Dad leads the way. I kind of just grew up following him.
No, you're doing cool stuff. I love that you're teaching other kids
Yeah.
in other countries to detail so that they can have a job, they can make money, they can help their families. I think that's really cool. How long has that spot been there?
I'm not sure.
Yeah, this does look like a mole, but it's, you know, a little bit angry from trauma, whether it was just because it started getting scratched. So I think most of the pattern that I'm seeing is probably due to the trauma and the scratching. This kind of mole on somebody who's 50 would definitely merit a biopsy. I think it's important that we keep an eye on it and follow it so we can take a look at how it is today and maybe check it in 6 months or so and see if it's changed at all. And do your best not to pick or scratch at it.
Okay.
But if it gets angry all on its own without picking or scratching, that's a good time to come and see us. Jealous of your hair. The thing I like is most of your moles are following the same pattern. When I magnify them, they all look the same. And that one looks the same, it's just been scratched. So I just got a little irritated. So again, trying to keep your fingers off of it, try not to pick it. And even on a little mole like this, you could put a pimple patch on it just to help encourage it to heal a little quicker. And then we'll recheck it, you know, in some months and just make sure that once it's all healed and settled down, it all looks okay. So far today, we have found 6 or 7 skin cancers on the dozen people that showed up to our screening. And hopefully you've learned a little bit about what to look for when it comes to self-skin exams and when you should see a dermatologist. If you want to learn more about what we're doing with the Motorhome and catch our next journey, there's going to be a video right here. You can check it out. Thank you for watching. I hope you've learned something, and I'll see you next time.